It's loading. Okay.
Hi, I'm Vic Khanna, a dermatology specialist of Illinois, and I have Marianne Rao and one of our medical assistants, Carissa, here today, and we're going to do, as part of our March Madness specials, we're going to talk today about PRP. PRP stands for Platelet-Rich Plasma. This is a like an extract that we draw from the patient themselves, from their blood. We spin it down and we extract a portion of the blood called the platelet-rich plasma. It looks like this. We call it liquid gold because it has all the growth factors in it to stimulate hair growth. And so Marianne has already just drawn my blood about 10 minutes ago, spun it down, and extracted the good parts, and now she's going to start injecting my scalp here. So anyway, she'll show you how it's done. Carissa, can you show a picture from before of, like, this is when I got my PRP the first time. We use this as a promotional item in our office so that people can understand what it looks like. So this is me in the beginning here, before my PRP treatment here. And I didn't think it worked after 6 weeks, but when I came back, this is what I looked like down here. And I had considerable hair growth. My staff had noticed it, my wife had noticed it, but I couldn't tell. But when I saw the pictures, I knew that PRP really made a difference. And then after another 6 weeks, I did it again, and it got even better. And so the initial series is a series of 3 injections separated by a month between them, between a month and 6 weeks between each of those injections or sessions. And then we do it every year. And so I'm due today. So okay, Marianne, go ahead.
All right. So the nice thing is here I am injecting Dr. Khanna, and I can see in the areas that I've injected, I injected him a year ago as well, and I can already see hair growth. So a lot of the times he may not necessarily be aware of the hair growth that's happening, you know, on the top of his head, but we already see quite a bit of hair growth. So he's doing actually really well. And just like Dr. Khanna said, we do 3 sessions and they're a month apart. And then afterwards we do a yearly maintenance treatment. And I have to say that patients come back for that yearly maintenance treatment. And that really speaks to the fact that the treatment regimen is very effective. People would not come back a year later and spend an additional amount of money if they didn't feel like they were getting excellent results. So you will be able to see those hair follicles, you know, kind of reawaken and reignite. We're really quite excellent here in terms of hair loss. I would say that Dr. Khanna is kind of a pioneer in hair loss because he's given us obviously the PRP, but many sort of tools in our toolbox. We've got vitamins, we've got, you know, suggestions, we've got topicals, we've really got excellent remedies for hair loss. So if you thought about, you know, your thinning hair, okay.
I'm going to put a little ice pack on there for a minute.
Okay, he needs a little break. I tend to talk too much and inject too fast.
No, your injections is good. It's just like, you know, PRP is a bunch of injections, right? So we take the growth factors from the patient's own blood, and then we inject it into the scalp, and that stimulates the hair follicles to redevelop, as she said, reignite. The hairs become thicker, they become of increased diameter, and like I have male pattern hair loss, right? So male pattern hair loss is familiar to most of us as the bitemporal recession, the thinning on the top, the little circle at the back that eventually becomes worse. We see it all around us. And this can be used for that, and it's one of our main uses for it. But I say we do a lot of female pattern hair loss, Marianne.
Definitely. Definitely.
We actually are doing so much PRP these days. It's incredible. The word is out. People are telling their friends. People are reading about it online. They don't know where to go. They don't know where to get reputable PRP. So we've been doing a lot of it here. One thing that we use a unique system for the extraction of the growth factors called the Selflo system. I evaluated all of the 5 major systems on the market, and I think Selflo is the best because it contains a certain ingredient in that when we're extracting the growth factors, which has a bit of a matrix that lasts in the skin a bit longer. So it doesn't just go in and then kind of your body just degrades it very quickly. It stays in, and it can give a sustained stimulation to the follicle with the growth factors. And so I think it just gives an enhanced result. Actually, I learned this from a friend of mine who specializes in hair loss and just does that. And he also is really pointing me towards this, and he said it's the best system. So we really found it to be the case. So anyway, I'll let you go do some more here for me too. So male pattern hair loss, female pattern hair loss.
That's right. It's not just males who are candidates, females are candidates as well. And so, patients can do.
Can we go on the other side for a little while?
Yes.
I'm a little sensitive there
You're
today.
sensitive on that side. Okay.
There's not a lot of bleeding with this usually.
The one thing I say is like patients will come back and during their treatment course, I understand that they're a month apart and so it is over the course of 3 months, but they can expect improvement even beyond that. And your results are ultimately yours to keep. This isn't something that ultimately wears off, right? So stimulating those hair follicles is something that healing process is yours to keep. And so the results can be really quite excellent. And the fact that patients come back on that yearly basis is really evident. They have less shedding. They'll notice it whether it's in the shower, in terms of their drain, or they'll also notice it in terms of their, their hairbrush. They'll notice improvement, so much less shedding. Dr. Khan is being such a trooper here because I've given him a ton of injections, but we really addressed the entire area.
I'd like to do a little bit in the front too to
Sure.
stimulate those follicles as well.
Okay.
Before you inject me though, I'm gonna take a little micro break again.
Okay.
and the whole treatment really takes about 10 to 15 minutes usually. I'm gonna put my ice pack on it. I feel like topical numbing helps. Sometimes I use the Zimmer cooler, which is behind us here. That blows cold air on the scalp and that tends to numb it a little bit. We don't use a lot of anesthesia. There's nothing really unnatural about this treatment. That's something else I wanted to tell you about. I feel like it appeals to a lot of our patients. These days people really want something that's natural. They don't want to take drugs. And hair loss it can be a chronic problem. And so there's something that if we start drugs, that's just something that's going to go on a long time. Now we do have medical options with medications too.
Yes.
Depending on the type of hair loss. But this is somewhat natural. I'm just using, what she's injecting is the growth factors from my own body. So I don't feel like I'm using a chemical or something that's foreign to my body. The other thing is like some people combine this with certain very specialized vitamins that contain shark cartilage and other natural ingredients that can only be purchased at dermatology offices because they're, at least at this point in time, and we're seeing great results with it, and that's another natural sort of solution. So not all of us are running, their medications can be helpful and they're definitely part of the treatment regimen. I personally am not taking medicines like Propecia or Rogaine. I'm not taking, but I'm not as motivated either. I'm not motivated to take any medicines. But like for male pattern hair loss, those are common suggestions, using Rogaine topically. I did use it for a number of years, and then I just gave up doing it because I started doing PRP, and I thought PRP was working better. It was working adequately. I guess at my age I don't care as much as I did when I was younger. Obviously this male pattern hair loss can affect anyone at any age. Female pattern hair loss can affect young women too. So they may be more motivated, they may want to combine therapies with more medications as well, but I find that this is a really effective thing for me. And it works for me, and I'll let you inject my
Barbara Weston says hi, Dr. Khanna in
hi,
Florida.
Barb. Hi Barb, how are ya? Miss you. I worked with Barb for a number of years at Mercy together. She's a good friend. I'm hoping all of you can call us now and if you wanted to get PRP, our phone lines were down, or we were having troubles, our internet was down, and so we were having trouble for the last day and a half. The Comcast people were just here, and I hope they fixed it. A lot of you, we've been trying to get back to you and couldn't get back to you.
The one thing to mention is, of course, we've got these specials for March Madness, so it's really a great opportunity to take advantage of some cost savings. If you've had hair loss on your mind and you've really kind of been contemplating what you could potentially do, this is an excellent remedy for hair loss. Our consultations are always free, so you can come in, talk to us, ask us questions. We're happy to spend time with you and really address any of your needs or concerns. We're almost done here, Dr. Khanna. You've survived the process.
Yeah, and PRP is a technology that's been around for it really, the technology and the idea of PRP has been around for decades. It's used in a number of fields. A lot of patients, when we talk about it or they ask about it, they're like, I think I had that injected into my knee or my ankle, or I've done they've done all kinds of regenerative treatments in their body with it, and it is the same technology. So it's used in a lot of different fields. In dermatology, we sometimes use it for facial rejuvenation, vampire facials, different things that that help rejuvenate the skin, and we do those things at DSI also. But really, our main push at our office, because we have so many patients in our area that have hair loss, is a big concern of theirs, and so and they read about PRP. It's sort of the newer treatment in the market. And since we've noticed results for the vast majority of our patients, we do endorse it and recommend it. And this is a good month, the March Madness specials. It's $200 off a package of free PRP treatments. What's the normal cost, Marianne?
$2,500.
So it's $2,500 is our normal cost?
Correct.
Okay, so now it's $2,300 for the series of 3. So
Yes.
And then maintenance is once a year, just like I just got my maintenance treatment now. It's once a year thereafter. And I think that's all I have to say. It's like, anyway, it's been a pleasure talking with all of you. And if you have any questions, you can set up appointments and come on in. If you want to do a telehealth initial consultation, Marianne's available for those, or any of our other PAs or myself even. So anyway, good seeing you today.
All right.
Bye,
Thank
everyone.
you.